Hey everybody, it's Dr. Falcone. How y'all doing out there? I'm going to get started in a minute. We're going to talk a little bit about sleep. One of the things that everyone desires more of, and most of us don't get enough of. So we'll be talking about that and just how to think about sleep in a very structured way, I think is helpful. So I'll be talking about all of that, but I look forward to answering any questions if you have them. If not, we'll get started in just a minute talking about sleep and how to get a good night's sleep. I'm going to be popping my glasses on and off. After a certain age, we are required to look at certain things with a little bit of help. Hey there, Mindy. How you doing? Glad you could join us. I got some people jumping on, which is awesome. We'll be talking about sleep and things that you can do to improve your sleep, sleep aids, sleep disruptors, which a lot of us do without really knowing it, give you a little bit of science behind it, and most importantly, the importance of sleep and what it means to you when you don't get enough sleep, which some of the data that's coming out is actually pretty impressive in a negative way, that if you don't get enough sleep. So we'll be talking all about that. We'll get started in just about 30 seconds. Talk for about 15 minutes. Happy to answer any questions folks have, and we will kind of get rolling. So let's talk in general about sleep and what it means to the body. So the first thing that I really want to talk about is kind of what happens when we sleep. So to take a step even back from that is, when we fall asleep at night, we go through some certain stages, as most of us would know. You kind of have light sleep, deep sleep, and REM sleep. So there's actually 5 stages of sleep that people have. There's 2 stages of light sleep, and that's just your body kind of slowing down, getting ready for getting into those deeper sleep. And then there's 2 phases of deep sleep, where your body actually does a lot of cellular repair. If people have done a workout during the day, that's when you have the majority of that muscle repair and even just general body repair, kind of cleaning out the toxins that are in your body. So that's usually typically in the deeper sleep. That's also when you do kind of start filtering the memories that you have during the day. You're exposed to millions of images, sounds, smells every day. And in those deeper phases of sleep is when your body kind of goes through it and starts sorting them out and saying which ones should we really be keeping and which ones should we just kind of forget about and let them go. Put them into the ether and keep the other ones in your long-term memory. And then finally, the last phase of sleep is what's called REM sleep, which most people know that as rapid eye movement. That's kind of your dream states when people dream. And typically what happens during the night is that you cycle through phases of sleep in about 90-minute chunks. You'll go through some light sleep, some deep sleep, some REM sleep, and then you'll actually intermittently wake up during the night. And most of us know that, especially as we age, that's a little bit harder and harder to do. So all of them are important, but in those 90-minute cycles, and it's individualized for everyone. Typically when you sleep in the early part of the night, you actually have more deep sleep, kind of thinking of your body repairing itself, sorting through those memories. That's the first thing that the body's going to prioritize. And then in the second half of the night, you actually have more and more REM sleep. So for folks that are getting less than 7 hours of sleep, you're actually robbing yourself of REM sleep. So why is REM sleep important? Well, that memory consolidation we talked about in the deep sleep, what happens is in REM, you actually start putting together these really abstract concepts and kind of connecting things without you even knowing about it. That's why sometimes some people wake up with some bizarre dreams. It's your brain trying to make these connections between all the different things that you have. And that's actually really important for abstract thinking, idea generation, and those kind of things. So if you're only sleeping 6 hours a night, you're getting less REM sleep. The minimum number of hours per night that you should be in bed, and we'll talk about that, is 8 hours. 8 hours is kind of the right number for you, and there's some really good data. For those of you that are book readers and like to read books or listen to them on tape, I would highly recommend a book called Why We Sleep, which is a book by Matthew Walker. He's a PhD researcher. He wrote it probably 5 years ago now. It was on the bestseller list for a long time. And it is a fantastic book for people that are interested in sleeping or knowing more about sleep and what it does for you. So what happens if we get less than 6 hours of sleep? So we have some pretty good data that things like your immune system doesn't function as effectively. Your response to vaccines is not as effective if you're getting a short amount of sleep every night. And they've done that through restricting sleep on students and then giving them, through studies, a vaccine and seeing what their immune response was. And they actually saw much less of an immune response when they had shorter nights of sleeping. So especially during COVID, it's one of the things that we talk about that's critical is to be able to generate that immune response to coronavirus and to your COVID vaccines that I hope everyone is getting. And that's one of the things that if you get not a lot of sleep at night, then that's one of the things that you're sacrificing is some of your immune health. The other things that your body depends on for that deep sleep is as we sleep, our body relaxes, right? That's one of the things that we all do to kind of regenerate and rejuvenate ourselves. And if you're not getting that sleep, your body doesn't have time to calm down. So if you're getting shorter and shorter amounts of sleep, then what you worry about is higher stress states like high blood pressure, diabetes, obesity. Weight gain is actually harder, or weight loss is actually harder for people that have shorter nights of sleep. So those are the things that we know through the science, and actually increased rates of certain cancers are being seen for people that are sleeping shorter periods of time. And finally, chronic diseases like dementia and Alzheimer's are certainly much more risk for people that have shorter amounts of sleep. So as we age, we normally have less sleep. That's just part of it. You know, your body has trouble sleeping. Typically, when you wake up in the middle of the night, you may wake up and not be able to get back to sleep. There's a medical term for it is insomnia. There's actually criteria for insomnia. So the criteria for insomnia is if you're not getting a restful night of sleep, an average of 3 days a week for 3 months, and it's affecting your ability during the day. So either you have trouble falling asleep, you have trouble staying asleep, you're getting up really early in the morning and can't get back to sleep, and you're having symptoms during the day like trouble concentrating, you have to take a nap, you're just fatigued in the afternoon. If you have that, then you meet the medical definition of insomnia. So what does that mean? Well, all of those other things that we talked about, then you kind of worry about, could this possibly be related to some of the illnesses or potential illnesses or diseases that you can develop? So what causes some of this? Well, I'd like to break sleep issues into three different buckets, if you will. The first one is minimizing what are called sleep disruptors. The second one is making sure that you have a glide path to sleep, and we'll talk about that. And the third one is making sure that the environment in which you sleep is appropriate. So let's talk about that first one, sleep disruptors. So there's a lot of things that can disrupt your sleep. So most commonly, one of the things that I take a drug I take on a daily basis, which is caffeine, certainly can be a sleep disruptor. And we know that the half-life of caffeine, which is if you take a cup of coffee how long will half of that caffeine still be in your body, is 6 hours. So if you're drinking caffeinated beverages later on in the afternoon, and that can be, obviously coffee, tea, sodas with caffeine in it, and you're trying to get to sleep, that may be one of the things that's preventing you from getting a better night's sleep. Caffeine suppresses the release of melatonin, which is one of the body's ways of getting you ready for sleep. So if you're taking caffeine in the afternoon, that's certainly something that can affect your sleep. The other thing that can affect your sleep is alcohol. We all know that when you take a drink or two of alcohol at night, you tend to get tired. But we all know that if you take more than one or two drinks and even close to bed, as we get older, it will disrupt your sleep. It will not give you a restful sleep. So alcohol is clearly a sleep disruptor. The other thing you think about is exercise. No, most people don't think about exercise being a sleep disruptor. Exercise is a great thing to do, and I highly recommend everyone do exercise on a regular basis, but try and exercise a little bit earlier in the day. If you exercise in the late evening hours, your heart rate needs to come down. That kind of all those good hormones that you pushed out during exercise need time to kind of go back to their baseline, their normal level, and it takes several hours for that to happen. And I know for some people that's just the reality, they have to exercise at night, but it may be something you think about is if you're having trouble sleeping and you exercise a lot at night, is that something that you can kind of shift to be a little bit more during the day? Another sleep disruptor is a lot of different medications can disrupt your sleep. Certainly for people that are on high blood pressure medicines, beta blockers, common sleep disruptors, a medicine called clonidine, which is also a blood pressure medicine. Some of the antidepressants, the SSRIs, can cause sleep disruption, which is unfortunate because people that are depressed sometimes are fatigued, but they also sometimes have trouble falling asleep, and sometimes the SSRIs complicate some of that. Certainly antihistamines can cause trouble with sleeping, and as we mentioned, certainly alcohol is a drug, and it could certainly be a sleep disruptor. So those are the things that can disrupt your sleep. So you want to think about, number one, if I'm having trouble sleeping or I have insomnia, is that one of the things that I should worry about? For people that are definitely having insomnia, we also want to rule out medical conditions for that, right? One of the most common diagnosed reasons for people having trouble sleeping at night is sleep apnea. And most people think of sleep apnea with people snoring loudly, awakening themselves or their partner in bed. And I can tell you that there are a certain percentage of people that do not snore and still have sleep apnea. So if you have chronic insomnia, that may be one of the things that you want to talk to your doctor about. Do you need to see a sleep specialist to make sure that there's not a medical reason for this? And certainly sleep apnea can definitely be one of the more common reasons for disrupted sleep. So we talked about sleep disruptors. The second thing I want to talk about is kind of what I call the glide path for sleep. Think of a pilot landing a plane, right? You want to follow the same pattern every time you land the plane, so you're going to land it safely, right? So when I think of the glide path to sleep, I think about, am I paying as much attention to getting ready for bed as I do when I wake up? I mean, we all set an alarm, or most of us set an alarm to wake up in the morning, but do many of us set an alarm to go to bed? We're all busy. We all have busy lives. So what I recommend is an hour before you want to get to bed, and let's say you want to wake up at 6:30 in the morning. So you want to be in bed by 10:30 at night to get that 8 hours of sleep. So by 9:30, you should set your alarm to remind yourself, have that cue of, okay, it's time for me to get ready for bed. So what does that mean? That means lowering the lights in the house, because bright lights will suppress the release of that melatonin that triggers your body to start getting tired. So that's one thing that you want to do, is make sure the lights are down. Make sure that screens are away, which is, TV, your iPhone, your iPad, your everything that we all have and live on and can't live without these days. Those are the things that you want to make sure that you're away from that. Hey, Maddie. See, people are waving at me, and I can't see because I don't have my glasses on, so I have to look really closely. So getting ready for sleep, making sure that, you have a nighttime routine. Herbal teas are great to take in the evening hours. It's funny. I've gotten into the habit with Chance, my 11-year-old, that he and I share a cup of chamomile tea at night, which is awesome because it's kind of something that we do together. We'll read a book together in bed, and he'll get ready for sleep. And it's a nice routine to have. Hot baths at night, hot showers at night are good ways to get your body ready for sleep. So that's talking about kind of that glide path to sleep, making sure the lights are down, making sure you start turning electronics off, giving yourself an hour before that so you can basically get ready to sleep. And the third component of that is kind of the sleep environment. So there's pretty good data that shows that we should keep the bedroom cool. So about 65 degrees is basically the best temperature for folks to sleep. That's been studied, and that seems to be the sweet spot, if you will. They make now these cooling pads. They're called chili pads. There's a lot of different brands out there that will actually cool the inside of your bed. And for those of us that sleep with a partner who doesn't necessarily like it maybe cooler than that or as cool as that, you can actually split it to different sides of the bed. So you can actually make sure that you keep a cooler environment. Make sure that your room is dark. Obviously you want to make sure that the lights are down. I drive my family crazy because about 9:30 at night, I start turning all the lights down in the house and they start yelling at me because they're still doing stuff. So it's just my reminder to me that I need to start turning things down and getting your brain ready for that sleep cycle. The most important rule of all the rules is to not sleep with your phone next to your bed. And I'm guilty of that. I can resist looking at my phone for the most part. I think that it is definitely a thing that all of us have gotten used to. I really recommend that you charge your phone away from your bed. People will say, well, I use it as an alarm. You can use it as an alarm on the other side of the room, which will force yourself to get out of bed, or you can buy yourself a $7 alarm clock and have it next to your bed. That's your choice. But the problem is when we wake up in the middle of the night, which is very common as we get older, it's just too easy to kind of roll over and tap your screen. And remember, the blue light from the screen actually it will suppress your melatonin. So you want to try and resist looking at that screen until it's morning time. Okay, go live. Can I go live? No. All right. So that's what I recommend as far as the environment to sleep. Make sure the room is cool. Make sure that electronics are away from your bed. Make sure the room is dark. They sell now blue blocker lenses, which filter out blue light, which is actually a good thing for people that are perhaps having trouble falling asleep. Filter some of that blue light that suppresses that melatonin release from your brain. The other thing is that we all should have a rule for your bed, right? Your bed should be for two things. It should be for sleeping and for having sex. That's the only things that should be done in your bed. And there's a lot of good data around not, having electronics in your bed, working on your computer in bed, watching videos in bed. I mean, those are all things that people do, but that's something that you really should avoid doing as much as possible. So just remember the bed's for two things, and your brain should really realize that it is for that, and that's kind of a message to you. So what if, okay, you've done all those things, you're not exercising at night, you've taken out caffeine, but you're still having trouble falling asleep or staying asleep. Now, there could be a lot of reasons for it, and certainly at Dignity Integrative, we will look into all of those reasons and kind of sort out what it may or may not be. So what if you're having trouble falling asleep? Kind of what should you do, or what could you do individually? Number one, you want to make sure, like I said, that this isn't a medical issue, that this isn't sleep apnea or something serious like that can really affect your long-term health. So that's something you want to, number one, notify your doctor about. The other thing is that there's different herbal preparations that have been shown over time to be very effective for sleep. Probably one of the most common ones is melatonin. Melatonin is a hormone. It's released by the pineal gland, which sits at the base of your brain, and it kind of tells your body it's time to sleep. And people think of, you hear my dog's barking, I apologize. People think when they take melatonin, it's like a sleeping pill, like they take it right before you go to bed. Actually, you should probably take it a couple of hours. Anywhere between 1 and 3 milligrams of melatonin is what folks or what people recommend. Some people have vivid dreams with melatonin, so just be aware of that as a not uncommon side effect. People describe them as bizarre dreams, but so that's a simple thing that you can take. There's another two herbal preparations that have been shown in some studies to be very effective. One is Valerian Root, which is grown widespread now around the world, but it's been shown to help with REM sleep, and in comparisons with people that are taking sleep medications, it's close to as effective. And I'll talk about sleep medications in a second. But Valerian Root, 600 milligrams a day, usually is effective. Now, any of the herbal medicines that you take, they're not like pharmaceutical drugs. They're not like you take it and the next day it works. Sometimes you have to be on it for 4 to 6 weeks to start seeing an effect, but you need to be consistent with that. The other herbal preparations that are very effective for sleep is ashwagandha, which is an Indian herb, which is now widespread and used all over the world in herbal preparations. It's used for people, the best way to describe it is if you're wired and tired, like you're just keyed up, but you're just fatigued. And for people that have that, you know what I'm talking about. Ashwagandha has been used very, very effectively for folks that have that type of kind of makeup, and usually about 600 milligrams of the root preparation a day has been shown to be very, very effective. And you take it throughout the day. You don't take it at night. You kind of take it throughout the day, so it allows you to kind of build up to a certain level. So those are a couple of herbal preparations that have been very effective in many cultures for that. I did mention sleep medications. When I was training in medical school, it was very, very common that I would prescribe sleep medicines for patients, especially when they were in the hospital. And what we're finding is that the side effects from those medicines, from a dependency standpoint, from a sleep disruption standpoint, when you're on them long term, and side effects like falling and memory issues are vastly outweigh the Ambiens, the Lunestas, all the things you see advertised for better sleep. They actually have very negative side effects, and I would encourage you to definitely stay away from them. You can become dependent on them, and you can actually have long-term side effects from them. So I don't recommend it for any of my patients. So that's definitely one thing. One of the other things that has been very effective for people that are having trouble sleeping is something called cognitive behavioral therapy, CBT, which is usually something that you can do through a therapist. It kind of structures your sleep through a lot of the things that I talked about, but kind of putting your mind and your head in the right place. There's actually an app called CBTI, CBTI Coach, I think, and it's available on the App Store and on Android, on Google Play. So just check it out. So if you're struggling with sleep, I think it's certainly been shown to be certainly more effective than the drugs. And doing the simple things like I talked about, taking out the sleep disruptors, making sure that you've got that glide path to sleep, and then finally making sure that you have a good sleep environment. Those are the ways that you think of sleep. And if you've done all of those things, then you can certainly move on to some other things, like maybe trying an herbal supplement, maybe definitely looking into cognitive behavioral therapy, which is a very effective way to deal with sleep and sleep problems. So that's kind of an overview on sleep. We know as we get older, it just becomes tougher to sleep. I mean, it's tougher to get that 8 hours, but I would encourage every one of you to really do what you can to get it. The health benefits, the impact on your immune system, the reduction in long-term health complications like hypertension, diabetes, ability to lose weight, and even some cancers. Seeing increased incidence with people that are sleeping shorter periods of time, less than 6 hours a day. So I would definitely encourage you to look into it. I like to talk about sleep as one of the 4 pillars, and as Rodney Dangerfield said, it's the one that gets no respect. There was a joke when I was in residency and I was doing my surgical rotation. The joke around with the surgeons is that, when do you sleep? Well, you sleep when you die. Well, the reality is, if you don't sleep, you're likely to die a lot sooner than you should. So I would definitely recommend that you make it a priority in your life. If you're having trouble or want more information about that, feel free to reach out to me, reach out to Dignity Integrative. I've written a blog about it with some more details on it. If you want a consult, please give us a call. We give free 15-minute consults on the website. Just fill out the form and be happy to get back with you and talk with you about it. So I hope that was helpful. If you need more information, continue in the chat and I'll check in on it, or feel free to send an email through the website. So it's Memorial Day is coming up. Hope everyone takes the time to be with families and friends. Remember all those folks that gave the ultimate sacrifice for us, and thank them for their service and their families. And I look forward to the next time we talk, which is probably going to be next week. So send in some questions if you got them. If not, I will look forward to seeing you next week. Have a great Memorial Day, everybody. Take care.